Let's start with the happy mnemonic I introduced a second ago. Here it is. And here are the viruses the mnemonic stands for: herpes, hepadna, adeno, parvo, papilloma, polyoma, and pox viruses. Let's start with the herpes viruses. Herpes virus is actually a family of viruses that includes HSV1, HSV2, VZV, EBV, CMV, and HHV 6, 7, and 8. These are the viruses associated with herpes, chickenpox, zoster, and mono. I'm going to come back to discuss all of these in a second in more detail. Hepadnavirus is next. There are 5 hepatitis viruses, conveniently named A, B, C, D, and E. Hepatitis B is the only DNA virus, while the others, A, C, D, and E, are RNA viruses. We'll come back to talk about all of the hepatitis viruses together later in this section. Next is adenovirus. Adenovirus accounts for a variety of clinical manifestations. These include a febrile pharyngitis or sore throat, rhinitis with common cold symptoms, atypical pneumonia, hematuria or blood in the urine due to hemorrhagic cystitis, and non-purulent conjunctivitis. Here is a picture of a viral conjunctivitis. You can divide conjunctivitis into purulent, aka pus-filled, and non-purulent, aka non-pussy. Viral conjunctivitis, such as that caused by adenovirus, is associated with non-purulent conjunctivitis. Just so you can compare, here is what purulent conjunctivitis, caused by bacteria, looks like. Parvovirus, which is next, is a high-yield virus to remember. It happens to be the smallest clinically important virus, measuring only 20 to 25 nanometers. Remember that it's the only single-stranded DNA virus. I've written out the other names for parvovirus, namely B19 virus or slap cheek disease. Do you know why it is called slap cheek disease? Well, because it is responsible for one of the 5 most common causes of pediatric rashes, known as erythema infectiosum, which also goes by fifth disease. As you can see from this picture, the name comes from the bright red rash that appears on the cheeks of infected children, along with a lacy red rash on the rest of the body. Interestingly, in adults it does not cause a rash, but instead causes arthritis, similar to rheumatoid arthritis. Joint symptoms are usually symmetric and most frequently involve the small joints of the hands, wrists, knees, and feet. For a refresher on different types of arthritis, go back and look at the MSK chapter and pay attention to the rheumatoid arthritis section for an understanding of adenoarthritis. So I've written another question here for you. How is parvo spread? Although it is transmitted through the respiratory route, it replicates in erythroblasts in the bone marrow. This is important because it causes 2 relevant hematologic complications. So one is in patients with sickle cell disease, where it can cause aplastic crises, also known as reticulocytopenia, aka a low number of reticulocytes. Remember, reticulocytes are the immature red blood cells in your body. If I were you, I would go back and read through your notes on sickle cell disease and hematology about this to remind yourself. But briefly, do you remember what type of anemia sickle cell disease causes? Right, it falls under the category of anemia with a high reticulocyte index associated with increased blood loss or destruction of red blood cells, aka hemolysis. So, large hemorrhages and hemolytic anemias fall under the same category. With these types of anemia, the reticulocyte count is usually high. Now, why would we care about that? Well, because parvovirus freezes the bone marrow, essentially preventing the bone marrow from spewing out any reticulocytes. So the sickler patient, who usually has a high retic count, will suddenly have a drastic drop in retic count. Do you think you know how you would diagnose this? Well, you can use PCR to identify the parvovirus, and you can also measure the retic count to diagnose the aplastic crisis. Now, remember that the other hematologic complication of parvo is in a pregnant woman. If a pregnant woman contracts parvo, it leads to red blood cell destruction and unfortunately leads to hydrops vitalis and the death of the fetus. Do you know what is hydrops? Well, essentially this is abnormal fetal fluid collections, such as ascites, pericardial effusion, pleural effusion, or polyhydramnios, that leads to the death of the fetus. That's why pregnant school teachers need to stay away from kids with slapped cheeks, unless of course the teacher's hand is the reason for that slapped cheek, in which case the legal system might order the teacher to stay away from the kid. Alright, next up we have HPV. HPV is a member of the papillomavirus family and infects squamous cells of the skin or mucous membranes, with different clinical presentations depending on the strain. You will hear more about HPV in the reproductive section, but we're going to briefly talk about it now. There are both benign strains and more malignant strains. The easiest way to remember is that usually the lower numbers below 15 are benign, and those above 15 cause more trouble. Benign strains include HPV 1, 2, 6, and 11, and can cause common skin warts on the face, hands, or feet. HPV 6 and 11 account for 90% of cases of anogenital warts, which are called condyloma acuminata. We know you want to see a picture of this. Here's a male patient with venereal warts in the anal region. Papilloma warts regress spontaneously after 1 to 2 years. Going back to the more malignant varieties of papilloma, the more high-risk sexually transmitted strains are typically the higher numbers. HPV 16 and 18 can lead to CIN, which stands for cervical intraepithelial neoplasia, which is a potentially premalignant dysplasia of squamous cells in the cervix. CIN is usually curable through resection, although a very small percentage can go on to become cancerous. Therefore, regular pap smears are necessary for monitoring. HPV 16 and 18 cause most of HPV-associated cervical cancers. HPV 16 and 18 is also associated with intraepithelial lesions of the anus, which can lead to squamous cell carcinoma of the anus. This is more commonly seen in HIV-positive individuals. There are currently 2 HPV vaccines which both protect against HPV 16 and 18. There was a lot of controversy about making the vaccine mandatory for school-aged children not that long ago. Regardless, pap smears are still highly recommended to screen for cervical cancers. Do you know why this might be the case? Well, it's because the vaccine covers most of the strains causing cervical cancer-associated HPV, but not all of them. That's why we will still continue to screen with pap smears. Our next virus, the polyomavirus, has 2 important members of its family, JC virus and BK virus. You are more likely to come across JC virus. JC virus is named for the initials of the patient who was found to have PML, or progressive multifocal leukoencephalopathy. That's a wonderful mouthful, isn't it? The neurology section will do a fantastic job explaining what this means and the symptoms associated with PML. But let's chat about it here first. JC virus is actually extremely common in the general population. In fact, most people are asymptomatic carriers by the age of 18. JC virus becomes pathological only in immunocompromised individuals, such as those with AIDS with CD4 counts less than 200, on chemotherapy or immunosuppressants. Reactivated JC virus causes PML, a demyelinating disease which destroys oligodendrocytes in the central nervous system and leads to speech, coordination, and memory deficits, depending on where the demyelination occurs. This is an MRI image that shows these areas of demyelination. As you can see, the areas are multifocal, hence the name, and hence the reason why the symptoms manifesting depend on where these demyelination areas occur. The other type of polyomavirus, the BK virus, really only comes about in patients who've had kidney transplants. The BK virus causes renal disease in these immunocompromised patients. Last but not least, the pox virus. Pox virus is the largest human virus and was notable for being the only DNA virus that replicates in the cytoplasm. Do you know what famous disease pox virus was responsible for? Right, pox virus was responsible for smallpox, a once devastating infection causing maculopapular skin lesions that later became raised, fluid-filled pustules. Sounds lovely, doesn't it? Smallpox was actually responsible for approximately 500 million deaths during the 20th century. However, thanks to the success of vaccination programs, smallpox was entirely eradicated from the human population in 1977. Here's a picture of a poor child who had smallpox. The reason people still worry about smallpox is that it could be used in bioterrorism. If you were ever to come across smallpox, which would be terrifying, how would you know that it isn't chickenpox? Well, remember that with chickenpox, the lesions are all at different stages of progression, whereas this is not the case with smallpox. As you can see here, all of the pustules are in the same state of progression. Here's an image of a cow's underbelly. Why, you ask, is there a picture of a cow's underbelly in this slide? Well, I'm glad you asked. This shows cowpox, which is actually the maculopapular outbreak that infected cows. Edward Jenner was an English physician in the 18th century who recognized the dairymaids who were infected with cowpox and developed these blisters, also called milkmaid's blisters, were found to be immune to smallpox. By creating the smallpox vaccine from vaccinia, aka cowpox, he was able to immunize individuals against smallpox. Today, the most common pox virus that causes human infection is molluscum contagiosum virus. Don't you just love that name? It sounds like you're saying Wingardium Leviosa or something similar. Molluscum contagiosum. That'll help you remember the name. In fact, it causes a self-limited infection characterized by flesh-colored papules on the skin. Here's a close-up of these papules. They illustrate a key feature to recognizing molluscum contagiosum, which is a central dimple or umbilication of the papules. This virus is transmitted by close contact. It is more common in children and immunocompromised individuals. Here's a patient with AIDS who had molluscum contagiosum, amongst other diseases.